If you've been told you need an epidural steroid injection for your back or leg pain, you may be nervous. And you may be wondering if you need to be put under. I'm Dr. Rainier Guiang. This is a lumbar epidural steroid injection, a treatment that places anti-inflammatory medicine near the irritated nerves in your lower back. We perform it under live X-ray guidance called fluoroscopy, so the medicine goes exactly where it should, and we do it with local anesthesia only. Many patients ask for sedation because they assume the procedure is painful. Here's the good news. When it's done well, it usually isn't. Skipping sedation has real advantages. There's no IV, no fasting the night before, and no grogginess afterward. You can usually drive yourself home and get back to your day. Staying awake is also safer. You can tell me right away if you feel anything unusual, which helps me keep the procedure precise and gentle. First, we get you comfortable lying face down with a pillow under your stomach. This gently opens up the spaces in your spine and makes everything easier. From here, everything is designed around one goal, keeping you comfortable. This next part is the most important, and it's the real secret to a comfortable injection. I use a very thin needle to place numbing medicine in the skin and the deeper tissues. You'll feel a small pinch and a brief sting, it's about like a dental injection, and then that area goes numb. Here's the key. Instead of rushing, we wait. We give the local anesthetic those extra few seconds to truly take effect before going any further. That short pause is the difference between a procedure that pinches and one that you barely feel. Now, because the skin is numb, I advance the needle through the area we already numbed. Using the live X-ray, I watch the needle the entire way, so placement is precise. I inject a small amount of contrast dye to confirm we're in exactly the right spot. Most patients feel only a sense of pressure here, not sharp pain. Then I deliver the steroid medication. You might feel a little fullness or pressure for a moment, and then it's done. Notice that throughout the procedure, the patient is awake, relaxed, and able to talk with us. No sedation was needed. The whole injection typically takes less than 10 minutes from start to finish. We place a small bandage, and that's it. We'll have you sit up slowly, and after a brief check, most patients walk out and drive themselves home. No recovery room, no waiting hours for sedation to wear off. Afterward, it's normal to have mild soreness at the injection site for a day or two. The numbing medicine may give you a few hours of relief, then wear off. The steroid itself usually takes a few days to start working, with the benefit building over the following days to weeks. Your care team will give you specific instructions for your situation. So, if you've been putting this off because you're afraid it will hurt, know that with good local anesthesia and a little patience letting it work, this is a quick, well-tolerated procedure for the great majority of patients. If you have questions, talk with us or your own physician about whether this treatment is right for you. Thanks for watching. We look forward to helping you find relief and get back to your life.